everyone. This is Taylor with Western Marketing. Just wanted to thank everyone for hopping on the webinar here. Today, we're going to have Caden with Allstate. He's going to go over their new medical expense shield product. This product's going to be really, really handy for you guys and gals that are in that ACA market, or even if you're in the Medicare market and you're starting to get those clients where they're turning 65 and maybe that spouse is still 61, 62, 63. This is going to be a nice ACA alternative for someone that's really not getting those subsidies. And the pricing is just kind of through the roof for a lot of those. Another tactic that you can kind of use on this one would also just be anyone in that ACA space that, again, is not hitting those subsidies that we're going to run into this year, and maybe they want to save a little bit of money as well. Those ACA alternatives are kind of few and far between these days, and from what I've seen on this looks to be kind of one of those products that you're going to kind of get the most bang for your buck. With the ACA premiums looking to have pretty significant increases this next year. I don't know if anyone else has been kind of taking a look so far, but they are estimating about an average of 14% increase in ACA premium alone. That's going to be just your median average, and that's nationwide so far. But I know some of the markets I've been looking at, specifically those of you maybe in Arizona and Florida, I'm seeing some 30% plus increases on a few carriers out there. So that is something to just kind of keep in mind. Feel free to reach out to me afterwards as well. I can get you the links where you can look some of that stuff up too. But it is something that I think this year we are definitely going to need some ACA alternatives. I know we needed it last year, and I think that pain is just going to get a little worse this year. So without further ado, I'm going to go ahead and pass the torch over to Caden here with Allstate, and I'll let him do his presentation here.
Awesome. Thanks for teeing me up there, Taylor. Appreciate you having me on, and thanks to Western Marketing and all you agents who have joined this morning. Appreciate your time. I know you could be doing a million other things as we gear up for open enrollment. It is a busy time of year, or kind of kicking things off and starting to be that way. So again, appreciate your time. This new product that Allstate Health Solutions has created, the Medical Expense Shield, is super innovative. It's new. It's a fresh perspective that's really going to give your clients a premium solution. Day one benefits, directly paid your client, but still very solid protection on the back end as well. So it's kind of a two-part product we'll dive into. If you haven't worked with myself or my team before, my name is Caden Bradbury. I'm a regional vice president over here at Allstate Health Solutions. Together I work with Sherry and Lynn. If you need anything at any time, feel free to reach out to us. I know Taylor and everyone at Western Marketing provides you guys a ton of support. But today we're just going to be having enough time to kind of talk the basics, right? Who is a good client for this plan? What are the basics of this plan? So you know what to look out for, but by all means, I don't expect you to remember everything from this presentation. More so, I want you to remember when to reach out to Taylor or Sandy or myself or Sherry so you can get that additional help when the time comes, because I'm sure you'll need it for your first couple enrollments, especially if you haven't sold anything with Allstate in the past. So you do have that support with you, but not only do you have support, you have an awesome bonus opportunity with this as well. So we rolled out this bonus at the same time we rolled out this plan, and we actually just extended it. So you'll see on the page here, it says it goes through August 31st. We've extended that through the end of September. So you do have about 2 months left to qualify for a bonus on this new plan. Super easy to qualify. We're not going to make you do 25 applications or anything egregious to qualify here. We know not every agent is capable of that. So you only have to sell 3 policies. You sell 3 of these policies, you qualify for the bonus. If you do 3-year plans, which is highly encouraged, there's no reason why you shouldn't, and you collect ACH payment instead of credit card, which again, no reason why you shouldn't, you get $500 per application. That is a huge bonus for only having to sell 3 policies. That's the best bonus by far of what's out in the industry right now. So again, we want to give you guys a financial incentive on top of already great commissions that you can go chase down. This is uncapped. So if you can go sell 10, 20, 30, you know, you can get thousands of dollars that way as well. And if you're unfamiliar with what Allstate does, we essentially have 2 product categories. So the first category of product we have is core health plans, ACA alternatives. Basically, instead of going ACA marketplace, we've got alternatives when people need a more affordable solution, or if people are outside of open enrollment, they lapse off because their premium got too much. Then we have an alternative here where people can save a lot of money. They can enroll year round. Part of that is this new product, Medical Expense Shield, which we'll be diving into. And another category is supplemental, dental, accident, cancer, all those plans as well, which we do a very good job at. So if you're looking for ancillary, please keep us in mind as well. But let's dive in here. What exactly is shifted in the individual health space? Because it's been a lot of shifting sands, a lot of movements. There's a lot of negative news in the industry on the over 65 side, on the under 65 side. Subsidy changes, carrier exits, commission changes, network challenges are becoming more of a problem. Increased exposures because deductibles and out-of-pockets keep increasing more and more and more every year. So there's a lot of turmoil in the market. You're having more hard phone calls with your clients than you probably ever have in the past, whether you're a 2-year agent or a 20-year agent. It's a really hard time to be in the health insurance industry just to keep up with everything and all the disruptions that have taken place. But there is substantial opportunity underneath these challenges, and that's what we're going to reveal today. Because at the end of the day, clients want 2 things. One, they want a policy that's affordable, and 2, they want a plan that works for them, not against them. And then you as the agent, you want a policy that actually pays you, right? So you're going to get substantially more commission selling these plans that are affordable and give your clients the protection they need. You're going to make way more money than you'd make selling an ACA marketplace plan. Couple things that have taken place on the marketplace, and Taylor alluded to some of those subsidies, the enhanced portion at least, were eliminated. So if you sold insurance prior to 2020, you're familiar with the income cliff. You make more than a certain amount of money, you get no tax credits, no subsidies, no help. And turns out an Affordable Care Act or ACA plan without a subsidy is very, very unaffordable, no matter how much money you make. Now the approximate income amounts are over there on the right-hand side of the screen by household size. So it varies based on how many people are in the family there. But on top of losing subsidies and having to pay full price for these unaffordable plans, people are also seeing massive rate increases. So 2026 was about 20% across the board. 2027 is looking a little better, 16% is what I've seen on average, but there's definitely states that are worse, like Taylor was saying, Arizona, Florida. But what's scarier is the compound, right? When you take 20% plus 16% plus maybe another 16% next year, it compounds and compounds and compounds. So already just 2026 and 2027's rate increase has compounded to about 40% across the board, meaning that $1,500 a month plan is now $2,100 a month, which is substantial rate increases for your clients. People's income sure isn't going up that fast, so it's hard to keep up with affording a health plan. Again, this Medical Expense Shield plan is going to give your clients a much more affordable solution. Also, individual max out of pockets keep going up. Deductibles keep going up. They went to $10,600 for 2026. They're going to $12,000 in 2027. Clients still have the same $700 in their savings account on average. So those gaps are getting bigger, and people really need day one benefits. So not only are they having a hard time affording premium, they're having a hard time, despite having health insurance, affording the actual health care because they're on the hook for the majority, if not all, the cost. So after chatting about all that and going into 2027, this is probably how you all feel. This is a little bit how I feel at times preparing for 2027. It's a lot to keep up with. Compliance updates, subsidy changes, carrier changes, plan changes, rate increases, right? So it feels a little bit like you're being drowned. in paperwork and everything else. But again, there is opportunity. There is that island of opportunity where you can still give your clients an affordable solution. You can still get paid and honestly probably give them a better plan than they've ever had before and make even more money doing it in the process. So again, people want an affordable solution and they want a solution that gives them a coverage that actually works for them, not against them. 96% of your clients never hit their deductible. That means 96% of your clients probably hate insurance and don't think it works because they pay for a plan that doesn't provide them value. With Medical Expense Shield, we're joining together two parts or two different solutions into one. This way, your client has everyday benefits for preventative care, surgery, hospital stays, you name it, day one benefits, cash benefits to help, combined with the power of catastrophic coverage. This is currently available in that Omaha market, Nebraska, South Dakota, Iowa. We've got it in Missouri, Arizona, Utah, Wyoming has awesome rates, Florida, and most of the South is going to be available as well. So a pretty wide footprint, and we're still working on expanding this further and further. I'm guessing a few of you are in Texas as well. That's a hot spot for health insurance sales. We will have Texas available with this product as soon as short-term medical gets back on 3-year plans, which they meet, if I'm not mistaken, tomorrow, the Texas Department of Insurance, to bring that back. So we're hoping for some good news soon. As far as who the customer is, it goes along with the subsidy changes and the rate changes, right? It's people who don't want to pay high ACA costs. They need budget-friendly options. They need an affordable solution. Also great if someone missed open enrollment period, you can sign up for these plans year round. There is no open enrollment period. Smart thing to do is with these private plans, kick off your open enrollment early. You can start selling these now in August, September. Starting in October 1st, we'll expand 90 days out on quoting. So you can start doing January 1st enrollments starting on September 1st. So again, open enrollments chaotic enough. If you can get some of these enrollments knocked out of the way for people you know aren't going to get subsidies, get those taken care of before open enrollment hits, so you have more bandwidth and more time to sell during that tight open enrollment window. We have next day effective dates. It also makes a lot of sense if someone's just between jobs, they're bridging the gap till Medicare, turning 65 clients. If you guys sell Medicare and you're just referring the business away for the 62-year-old, 63-year-old spouses instead of selling those, you're missing out on a huge opportunity because again, these pay significantly higher commissions than you're going to make selling ACA or referring that business out. How this benefits you as the agent: one, it gives you enhanced ability to cross-sell. When you sell a more affordable plan, you have more wiggle room to sell that life insurance, to talk about those investment accounts, those annuities, get an accident plan or a dental plan in there as well. You're going to earn way more. On average, you're earning 3 to 4 times as much commission selling this versus what you make selling an ACA plan. And also, you're giving your clients that affordable solution. Now, how it differs, which this is an important part of the conversation, is who does this plan make sense for? So part one of that conversation is affordability and year-round enrollments, right? Outside of open enrollment, perfect fit. Don't get subsidy, perfect fit. But the other side of that is these are medically underwritten products, meaning your clients do need to be relatively healthy to make sense for this plan. For one, you need to qualify for this plan. There's a few underwriting questions you need to pass: no diabetes, no heart attacks, no cancer. Again, we're looking for relatively healthy people. This is an underwritten product. The other part of that conversation is this plan does not cover pre-existing conditions for the first 12 months of the plan. So again, another reason why I highly encourage you to sell 3-year plans is pre-existing conditions or health conditions that are occurring prior to the policy beginning are excluded for the first 12 months, but then year 2, year 3, that exclusion goes away. Think of this kind of like a car insurance policy, where if you crash your car, you can't call up an insurance agent after the fact, get insurance, and have that wreck covered. You need to have the insurance in place before that crash happens. Another part of this conversation is there is no maternity or pregnancy coverage. So if your clients are planning on getting pregnant, currently getting or currently pregnant, please put them on an ACA plan. Even if it costs a lot more, it's going to be a better fit for now. You can divide the family up. So if there's children, we can do a child only plan, or a husband, you can put him on the plan while the wife's potentially getting pregnant in the future. You can keep her on the ACA. So you can definitely split up the family that way as well. As far as the underwriting questions here, pretty basic stuff: heart disorders, diabetes, cancer. You'll see this during the application, so I don't want to spend too much time diving in. But again, we're looking for healthy individuals. So you need to, one, be healthy, and then if you are outside of open enrollment, you're not getting subsidies, perfect fit, huge win-win for both you and your clients. Because like I said, you're going to save them significant amounts of money. This is a snapshot from our quoting portal. In that Allstate quoting portal, you're actually able to put an ACA marketplace plan side by side in Allstate private plan. So this is an ACA plan in Liberty, Missouri for a family of 4. Runs about $1,400 a month for basically the worst plan you can get. $7,500 deductible, not the best network, versus an Allstate plan with a nationwide PPO network with day one benefits. You're looking at $800. In Nebraska and Arizona, this comparison is going to be even more drastic and have an even better premium effect for your clients. So it just depends on state how drastic this difference is. But in most states, we're going to be around half the cost there for your clients, saving them thousands and thousands of dollars. This family of 4 would save about $7,000 a year. So let's talk about how this plan works and the basics there. So again, you get set dollar amounts, everyday help for your everyday healthcare needs. There's no deductible, which is absolutely insane because again, 96% of your clients never hit their deductible. They have no help up front with their medical care, and so they really feel like insurance doesn't work. With this plan, they're going to have benefits day one up front for everyday healthcare needs. A few additional highlights here is you can do a 3-year price guarantee for that long-term plan stability. You don't have to worry about the price jumping up and up and up like that 20%, that 16% increase we're seeing on the ACA. You can lock them in and help them have that price stability. This is going to cover preventative and unplanned at first dollar, which is pretty special. No social security numbers are required. So if you're joining me from Arizona or Texas or Florida, I know you have significant amounts of clients potentially who are non-citizens or don't have socials. This can be a perfect setup for them. No citizenship, no social is requested or required. You can also do children only plans. A few reasons why you'd want to do that. Sometimes parents are unhealthy, so they belong on ACA, but the children are healthy, so save that family premium by putting them on a private plan like the Shield. Or parents have group coverage that's super cheap, but it costs a lot to put their kids on the plan. Again, you can put their kids on this plan alone. So how this is going to work, and I like to use a visual example here because again, traditional health plans like an ACA, like a group plan, this is how they work. You get total bill in the mail, and who pays first? Your client does. There's deductibles, coinsurance, copays. Again, 96% of your clients never hit their deductible, which is an insane statistic with how much money people pay for insurance. Now, if your client does happen to hit their commitment, their deductible or coinsurance or copays, insurance steps in and basically pays the remaining bill. With Medical Expense Shield, we're going to flip who pays first and who pays second. And this is where your clients are really going to enjoy how this policy works, because instead of them paying first, total bill is going to come in the mail. And with these day one benefits, Allstate's going to pay first. We pay first for the majority, if not all, of that bill. And then after that portion is paid, if there's any remaining bill, your clients would end up paying the rest. So how this looks is basically a menu of benefits. So hospital admission, ambulance, is you name it, are going to be on there. $2,000 if you get admitted to the hospital. Every day you're confined there due to sickness, you're getting $3,000 to $12,000 per day, depending on if it's injury or sickness and what year of the plan you're in. You're also getting a nice perk there for observation unit, and all these stack up. Ambulance, air ambulance, life flights, very good coverage there, especially for your rural clients where that's more likely. $25,000 is unheard of for a plan like this. Ambulance ground, $1,000. You also have surgery benefits. One thing I'll point out on here is the outpatient surgery benefit here. That is going to cover a colonoscopy. That's going to cover an endoscopy. So those surgeries that all your clients ask you about that they need for preventative reasons, we're going to pay out a massive sum of money. Now, the awesome part is about colonoscopies and endoscopies is they only cost a couple grand, where we're going to pay out $4,000 or $5,000 for the outpatient surgery. We're also going to pay out 500 or $1,000 on outpatient anesthesia and another 500 for outpatient surgical facility, meaning you're at minimum getting 5 grand for this surgery. It only costs you 2 grand. Your client's going to pocket that check, only have to pay 2 grand of it, and essentially make money by getting that surgery done. So if the benefits exceed the bill, your client gets to pocket that extra cash. This plan is also going to give you office visit care, preventative care, urgent care, $150 per visit on the core. On the plus, you're going to get a little more. A lot of clients who are on ACA marketplace plans, they're used to having that annual exam or that annual physical taken care of first dollar. So this gives you the ability to still give them benefits for those visits. They'd get $150 for the preventative care. They'd also get $35 per lab. Usually labs are done at the same time as those preventative exams as well. You've got chemotherapy benefits. So again, you have benefits for essentially everything under the sun. Day one, cash benefits paid directly to your clients to help with everyday health care needs. Now, a lot of people ask about prescription coverage as well. We've got Recuro. I won't spend too much time here, but Recuro basically gives you a $0 copay on 95% of generic medications. You pay nothing for them. You can go to CVS, Walgreens, Walmart, Kroger, all the big box stores are in network. You also get unlimited telemedicine visits with this service, and it only costs $10 a month for the entire family, unlimited family members. There's also a behavioral health add-on for an extra $5 if you want therapy visits as well. Now, this plan has a really cool perk where it's going to use the Aetna Open Choice PPO network. And most plans these days do not carry a PPO network because the networks are so strong. It costs insurance companies too much money to provide you access to that amount of doctor offices and that amount of hospitals. This is a nationwide PPO, so you're going to have incredible network access no matter what state you're in. So if you travel frequently for work, you're a traveling nurse, traveling salesman, you go on vacation a lot, having in-network providers, no matter what state you're in, is a massive, massive perk. There's only a few state exchanges that still even offer PPOs, and oftentimes they cost an arm and a leg. So this is a premium product. Day one benefits combined with a premium network is really going to give your clients a special combination. So let's look at a few examples of how this plan will work now. This will be on the covered core, so the lower tier of the two, but still going to shake out really nicely for your client. So this is an example for a preventative care office visit or annual exam. $150 is the benefit we're going to send them for the preventative office visit. Let's say they do 2 laboratory tests. We're going to send them another $70. So now we're looking at $220. What the bill comes in at is about $426, and then Aetna, that premium network, is going to reprice that or do an in-network discount, shave off about 38% and get us down to $268 is the real bill after the in-network discount has been applied. So because we've sent your client a $220 check, they've already got that cash by the time they get this bill in the mail. And now they can use that to pay for that $268. They've just got to come up with another $48 out of their own pocket to essentially finish off that bill. But we have covered 82% of the exposure. Again, day one benefits. Preventative coverage does have a 90-day waiting period, but if they were sick, if they break their leg, if it's an emergency situation or an unexpected event, you have day one coverage. Preventative care, just make sure you wait 90 days. There's no rush for preventative care, as it would be more preventative, not diagnostic. There's no rush for that. Let's look at a bigger example now. This is a torn ACL. So Michael's walking his dog, somehow tears his ACL, needs surgery. Again, this is the core plan. So these benefits could look even better if you went with the plus, but the core still does an amazing job. $18,000 surgery. That's the treatment cost in network. So they get a $7,200 in network discount, shaving off a good chunk of that bill, but they're still left with $11,000. Now, right here, before we go over these benefits, I want to pause, because if your client was on a catastrophic bronze plan with a $12,000 out of pocket here, they would be paying that full $11,000 out of pocket. Their insurance would cover $0 of this. If your client's on a $7,500 deductible bronze plan, they're paying $7,500 minimum, and then probably 50% of the cost after that. So that's a huge exposure out the gate for your clients. And again, most of your clients can't pen that check. The cool part here is, again, day one benefits. So you got surgery benefit, $4,000 for that outpatient surgery. Assistant surgeon, $1,500. Anesthesia, $750. Ambulance, outpatient surgery center. All those benefits stack up, cash pay. So we send your client essentially an $8,000 check in the mail. And then when they get that $11,000 bill, they only have to come up with $3,000 of their own money. Again, $3,000 out of pocket is significantly lower than what a bronze plan or silver plan exposes your clients to. And I know your clients without subsidy, there's no way they can afford a platinum or gold plan where this is putting you similar to that premium style of coverage. Now that we've talked about the little stuff and the medium stuff, a few of you more experienced agents might be saying, well, what about the big stuff, right? Because what we just talked about is essentially an indemnity plan. It's a very good indemnity plan. It's a very good fixed benefit plan. But this is where part two comes in, because traditionally those fixed benefit plans, when the big stuff occurs, the insurance pays first. But what if it's a $300,000 bill and the insurance pays $150,000 first? We do not want your clients to be left with a $150,000 bill. And when agents sell fixed benefits standalone with nothing else, which is really all that's available in the fixed benefit market, your clients have a massive exposure on the back end. And that's when there's financial catastrophes at the worst possible time. So what we've done here is, again, we've only talked about half the plan so far, which pays first. The other half of this plan is also going to pay last. So we pay first, we pay last. Your client might bridge a little bit of gap in the middle, but this is going to have essentially a stop loss catastrophic protection on the back end, not for all your clients, but for that 1% of your clients that does happen to have a heart attack, for that 1% of your clients that does happen to get that cancer diagnosis. You can rest assured that they're going to have significant financial protections here. So not only are you having day one coverage for the ACL surgery, for the preventative care, for the urgent care visit or the broken arm, but you also have catastrophic protection on the back end. How that's going to work is a short-term medical policy, which can be 1, 2, or 3 years, with an extra $5 million of coverage on the back end. You can choose between 2 deductibles. They're catastrophic size deductibles because, again, you have those day one fixed benefits where those entire fixed benefits are contributing towards this deductible. So you can choose between $25,000 or $35,000. Again, I don't want the alarms to go off. We'll cover an example here, because with that ACL surgery we looked at, client was only out of pocket $3,000. But guess what? That full $11,000 post-network discount, that full $11,000 went towards this deductible. So already after that ACL surgery, this deductible would already be half taken care of. Now, let's say something bigger happens. Coronary artery bypass, $87,000 surgery. In-network discount shaves off about $14,000. So we're left with about a $72,000 bill. Again, this is going to be the $25,000 deductible. So that's the real exposure for the client, not the $72,000, but the $25,000. The good news is all those fixed benefits we talked about in the first half of the presentation, on the left-hand side, ambulance, emergency room, surgery, anesthesia, hospital admission, labs, you name it, those all stack together and they add up to about $21,600, meaning those fixed benefits are going to take care of 90% of this deductible for your client. Your client has to bridge the gap between $21,600 and $25,000. That costs your client about $3,300. And then after that deductible's been met, that extra $5 million kicks in and covers the entire cost of this surgery after that. So actual out of pocket for your clients here, $3,300 for a coronary artery bypass. Again, if they're on a bronze plan or silver plan, we're talking about your clients paying $7,000, $8,000, $9,000, $10,000, $12,000 out of pocket for this surgery. And here they only have to pay $3,300 out of their own pocket. The bigger, crazier part about all this is once that short-term medical deductible's been met, it's covering all the costs, but the fixed benefits are going to continue to pay out. I mean, your client can continue to pocket that cash. So this is about the worst scenario your clients could have if they have a $200,000 surgery and get $100,000 in benefits. They get to pocket the majority of those benefits because only $25,000 is needed to satisfy that deductible. So let's say they satisfy their deductible here and then they tear their ACL. Instead of paying $3,000 for that ACL surgery, they basically get it done for free. Plus they get a pocket $8,000 in their pocket. So the fixed benefits we talked about in the beginning don't shut off. Everything that those pay off is going towards your client's deductible here. This is really just the cherry on top. Again, the 1% of your clients who have a heart attack, have a cancer diagnosis, you can rest assured that even though they have these amazing day one benefits, they also have catastrophic protection in the form of an umbrella or a shield. Hence why this is called medical expense shield. Now, it never hurts to add supplemental insurance on top of anything. You can sell this with ACA, you can list bill it with a group, or you can sell it with this medical expense shield as well. When you do cross-sell, you improve retention, you generate more referrals, you increase commission. And the first plan I like to talk about here is the Plan Enhancer Accident Plan. This is a really solid one that can fill in the gap. I don't think you need anything insane on the benefit levels here. We do go all the way up to $35,000 now, but this accident medical expense shield plan pays for the entire accident up to the benefit level you choose. So if you get in a $10,000 surgery and you have a $10,000 plan enhancer, it's going to pay out that full $10K directly to your clients. This can help bridge that gap in the middle. That way your clients don't have really any exposure on accidents. You also have a couple optional riders here, cancer, heart attack, and stroke rider, not on for an additional cost, matches that same benefit level, first ever diagnosis, pays a lump sum directly to your clients, and a sickness hospitalization rider. If they're admitted to the hospital due to sickness, again, pays out a lump sum to your clients. And again, this is going to be a really good gap filler to kind of bridge that gap in the middle of the fixed benefits that do pay to get you to that catastrophic coverage through the short-term medical. This plan is also super affordable. So again, whether you're selling ACA, an Allstate private plan, or a group plan and you want to look at list billing, this plan always makes a lot of sense. We also have a standalone cancer, heart attack, and stroke plan, guaranteed issue for 25 and 30K levels. If you want to an even higher amount of coverage here, you can answer some underwriting questions and get some additional coverage there. Everyone's worried about cancer, heart attack, and stroke. Everyone's either in a cancer family or they're in a heart attack family. The problem is most agents don't offer this to clients. And I promise you, your clients have no idea that this kind of protection, that a cancer insurance or a heart attack insurance even exists. So if you don't bring it up to your client, they're never going to know it exists. They're never going to have the opportunity to have that financial protection. So it's important to give them that right of refusal. We also have insane dental plans over here. So I know there's a few dental plans out there with $5,000 annual max or a $10,000 annual max. This copay plan too has no annual maximum. You can't run out of coverage. $0 or no annual maximum. You can't run out of coverage. And then also, I know a lot of those dental plans you guys like that have the $5,000 annual maximum, they still have waiting periods for major services. 12 months oftentimes. This plan also has no waiting periods whatsoever. So if you're not already selling Allstate Dental, if you're selling a different carrier's dental plan, definitely give us a look. This uses the Aetna PPO dental network, which is very strong. Your $0 for preventative, root canal crown as soon as tomorrow for $500, extraction for $125, billing for $100. Copays get even better in year 2. We also have some more traditional style dental plans, Value Plus, and the Prime plan is particularly very strong here because this is going to provide your clients orthodontia benefits if they're 18 years old and younger. Whether this is a family plan or you can even do a child-only plan here to get those orthodontia benefits as well. So a lot of different dental plans, solid dental network, and our dental insurance affordability is much more affordable than those other dental carriers. I know you guys are selling $60, $70, $80 a month plans. These usually run $40, $50 a month. So to recap our conversation, medical expense shield, best of both worlds. You get day 1 benefits, 0 deductible that are going to give your clients cash benefits for everyday health care needs, urgent care, preventative exam, ambulance, hospital stays, you name it. And then if your clients are that 1% of unlucky customers who do get in that catastrophe, the heart attacks, the cancers, the major hospital stays, this has an additional $5 million of coverage on the back end built for catastrophes to give you that shield protection. Again, coming back to this bonus goes through end of September, $500 per application. $500 per application. You only have to sell 3. So super easy to qualify, uncapped. And also, I forgot to mention this in the beginning, but if you bundle it, you make even more. So every policy you bundle with it, if you sell that cancer, heart and stroke, the dental, and the accident, you get $25 extra per policy you bundle with it. So you could really get $575, $600, depending on how much you bundle there per application. Just make sure you're doing the 3-year plans and get an ACH for the payment method. Couple highlights to recap: day 1 everyday benefits, preventative coverage. We can do children only options. There's no social security numbers required. We've got guaranteed issue accident all the way up to 75 years old if your Medicare sells as well. You can sell that plan enhancer to your Medicare clients. Got awesome cancer, heart, and stroke plans, or those critical illness plans, reliable dental coverage, amazing rates, unique coverages as well. If you need anything anytime, again, feel free to reach out. Take a screenshot, please, right now, or write down my email, phone number, as well as Sherry's, and reach out anytime. We are more than happy to help you guys out. It looks like we have a little extra time, so I'm going to jump into a quoting demo. Taylor, do we want to open it up for questions now or save those for after the quoting demo?
Sure. I mean, I only see like 1 question, so we can answer, and I'm sure it's a nice, easy one for you. Gary was asking, how long does it usually take for the customer to receive the check from the company to pay his or her bills at the doctor?
Yeah, great question. So how this claim is going to work is you're going to have an ID card, just like everything else. You're going to present that to the doctor, and that's automatically going to start the claims process. Now, as you know, doctors' offices, hospitals, it takes forever for them to process bills and send them out, oftentimes 3, 4, 5, 6 months, sometimes as fast as a month or 2. But we should be able to process this within 3 to 4 weeks, get your clients that cash benefit in the mail. That way we beat that bill in as far as timeline goes, so your client has that cash benefit before that bill even arrives.
Can the client elect for the doctor to receive the payment directly from Allstate, or is it going to have to be a reimbursement?
Yeah, not at this time. At this time, that cash is going to flow directly to the client. But then the short-term medical side, if that deductibles ever hit in a catastrophe, those payments obviously would flow directly to their provider and just take care of all the costs.
Perfect. I think that pretty much answers all the questions.
Awesome. So let's dive into quoting example now. If you guys haven't used the Allstate quoting platform, super up to date, super easy to use. I plugged in an Omaha zip code here. I'm going to go with a female, and we'll do 40-year-old, and we'll do an effective date of 9/1. Perfect. I'm going to plug in a spouse and some children as well and hit quote now. From there, I don't need to put in all the names, so I'm just going to plug in the birth dates. I'll match that 40-year-old for the husband. We'll do 2017 female and a 2022 female. So family of 4, hit quote now, and that's all you have to do to get in here and start seeing rates. If you want to see those ACA prices, you can hit this Health on Exchange button, answer the nicotine question. It always does, just like Health Sherpa does or any other quoting platform. We can plug in an income here, 130,000, that would disqualify them for subsidy. So we can kind of get a picture of what we're going up against. Hit show plans. It's going to load for a few seconds, usually about 5, and we're in. So $0 subsidy, it calculated family for, again, worst possible plan you can go with on an EPO, $1,600. If we go up to a couple of these other plans, we're still in the bronze category. Bronze category, 1,900. Getting up to silver, we're started about $2,000 still with a $6,000 deductible. So you can see ACA plans for family 4, if you can afford 20, 30 grand a year, looks like you can get coverage. But again, pretty unaffordable if you're not getting subsidy. And just because you're making 130, 140 grand a year, which is considered really good income, having to put 20, 30 grand of that towards health insurance is super unaffordable for that family. So let's look at some alternatives here, see if we can do better than, $1,600 to $2,000 a month. Go to that medical expense shield button. It's going to ask you if you've had any type of insurance for 9 of the last 12 months. This can be any type of health insurance, private plan, marketplace group, doesn't matter. That's more of a preferred rate question rather than an eligibility question. Now, depending on their weight and that question, you might want to see preferred rates. And if you can answer no on motorcycle, DUI or more than one speeding ticket, high blood pressure, high cholesterol, anxiety, and depression, you get an additional 20% discount off the rate. So now we're looking at preferred rates. You'll see 2 different options here. I would recommend hitting the monthly drop down and finding that 36-month plan. That way you're getting that $500 bonus and your client's also protected for a full 3 years. Now we can go with a 36-month plan and it'll be a little cheaper during year 1, or we can do the 36-month rate lock. It's going to be a little more expensive during year 1, but now your client doesn't have to worry about taking a rate increase in year 2 and year 3. With those ACA marketplace plans, we'll run a quick calculation here. If they go with an $1,800 a month plan, and it's going to take a 16% increase here in 4 months. And then let's say it takes another one for plan year 2028 and another one for plan year 2029. By year 3, your client's going to end up paying $2,800 a month for that ACA marketplace plan, where if you do this 36-month rate lock, your client's still going to be paying that $1,000, $800 here, saving significant amounts of money year 1. But also because you elected to do that rate lock, the savings get better and better and better over time, becoming a third the cost of an ACA plan by the end. So we've got the core plan options or the plus plan options. I would say with how much savings we're seeing here and how good of a plan this is, you're just fine going with the covered core. If your client wants a little extra protection from those catastrophes, you could go with the $25,000 deductible instead of the $35,000 deductible. But again, that's more of a cherry on top coverage. That's 1% of your clients are going to access that. What I would do instead is take that extra premium and put it towards the plus plan. That way you get bigger day 1 benefits, and we're still about $1,000 a month. Add that to the cart. You'll see Recuro pop up as well. Again, this is going to give you generic prescriptions and virtual telemedicine calls 24/7, 365 days a year, and then an extra $5 will give you behavioral health. Most clients like to keep prescriptions and the telemedicine, but not every client chooses to keep that therapy, totally dependent on your client's situation. Now, once I've added that to the cart, again, we're already saving your client $600 to $1,000 per month, and we're giving them a nationwide PPO plan. That nationwide PPO network is worth a premium price. These day one benefits worth a premium price, but somehow we're saving your clients $7,000 to $12,000 per year. Now, when I go over here to cross-sell, the first step I'm going to go to is accident plan. I'm going to go find the plan enhancer. And again, we can go all the way up to $35,000. I think that's overkill. Let's just get an additional $10,000 for this family of 4. That way they have a little extra protection for accidents, an extra $46 a month. They're still saving a ton of money. I can also add the cancer, heart attack, and stroke plan for an extra $40 a month. Get them that extra $10,000 there. For an extra $80 a month, I can get them sickness coverage. I'm gonna go with the sickness plan and actually show you a little trick that I like to do. So I'm gonna go sickness. That way they have 10,000 for accident, 10,000 for sickness. And then instead of doing the cancer, heart attack, and stroke rider here, what I'd recommend doing is going over the cancer, heart attack, stroke tab. And for about that same $40 a month, I can get them $25,000 instead of $10,000 of coverage there. Add that to the cart. So now we've got $25K for cancer, heart, and stroke, $10K for accidents, $10K for sickness, on top of an already premium coverage plan with day one benefits, nationwide PPO network, rate locked for 36 months. I don't have to worry about a rate increase. I can do the dental plan, family of 4 on that plan with no waiting period, no annual max, $145. I know for a family of 4, a lot of you guys, again, are selling plans that would cost this family of 4 $250. So an absolute steal. And again, our Aetna dental network is really solid. For this family with kids, you might want to go prime, get those orthodontia benefits. So we could add that dental prime plan in. And that one gets you a bundle discount as well, knocking it down to $142. So now we are fully loaded. Again, you don't have to do all this coverage. These are conversations I think you should have with your client, but we're still saving your clients money. But we've included accident, sickness, cancer, heart, stroke, dental, as well as that premium plan option. More of an apples to apples comparison from a price perspective compared to that $1,600, you're looking at $1,000 versus $1,600 to $2,000 with a terrible network and a massive out-of-pocket exposure on an ACA bronze or silver plan. That's my spill for you. We'll open it up for questions. Taylor, super grateful for you letting me have this opportunity to speak. And thanks again, everybody, for hopping on today. Love my partnership with Western Marketing. And if there's anything I can do for any of y'all anytime, please let me know.
Yeah, I mean, I'm not really seeing too many questions here. Gary, I see you're asking about commission. Contact me afterward on that. We typically don't discuss commissions, as sometimes there are downline agents of agencies on here. So we can have that as a one-on-one combo if you want to give me a call or shoot me an email afterwards. But yeah, no, Caden, thank you so much for, presenting this. And guys, I do want to just kind of reiterate, like, check out that bonus program. I've worked here for almost 12 years now doing this. I can't say I've ever seen a $500 bonus per policy on something that honestly I think is pretty easy to sell when you just line it up. And then, yeah, throw $25 on for cross-selling, which, I mean, as agents, we should all be doing that anyway. So, qualifying for this with only 3 policies is nice. I mean, I have other carriers that require you to get 20 policies in order to get any bonus. This they're only doing 3. So I think capitalizing on this is just going to be real critical this upcoming year with the ACA. Exactly. I mean, it's going to be rough. It was rough last year. I think a lot of us that went through it know that, and it's going to be rougher this year. It's cumulative. It's getting worse and worse. The increase we took last year, now we're taking a 14 to 16% increase on top of that increase we took last year. So, we already were hunting for ACA alternatives. I work with a lot of other IMOs as well out there that operate in that ACA space. They're hunting for them too. They called me and they say, Taylor, what are we going to do? Well, this is what I'm telling them. So I think this is going to be really nice. I know a lot of you are in Texas, so you know, as soon as Caden sends me a text message, hopefully tomorrow, I'll be reaching out to you know, all my Texas guys here saying, hey, Allstate's coming, because I think this is critical down in Texas for sure. But you know, in all those states, this is gonna be a game changer for you guys. So once again, in the chat box, I did put our link to request the contract in there. My email, if anyone does need it, is Taylor, Taylor, at wmacorp.com. Feel free to reach out to me that way. I will get a recording of this sent out here. It'll probably take me about 30 minutes to an hour or so to get that up, but I'll send a little something out to everybody that was in attendance, and if anyone missed it, I'll also get it out. So with that, we'll go ahead and wrap it up since I don't see any more questions. So yeah, if it's something that you're interested in getting set up with, reach out to me and we'll get you guys all set up.
Thanks, Taylor.
Thank you, guys.
Appreciate you.
Bye.